Today, we welcome Professor Shannon Nix from Community and Public Health, and she will address the question, is psychosocial health the key to improving rural breast cancer inequities? Thank you.
Hi, everyone. Thanks so much for being here with me on such a drizzly and wet early evening, but I'm excited to be here with you nonetheless. Today we're going to spend a little bit of time talking about breast cancer survivorship. I'm going to have a seat up here. I shared with Rox a little earlier, I took a tumble down my stairs, so I'm a little sore and not really able to stand for too terribly long, but this is an informal conversation. I hope that we all can engage in discussion about the challenges that women who are diagnosed with breast cancer face, particularly those who live in rural communities, and talk about the ways that social support can help to improve psychosocial health and the quality of life of those survivors going forward. So I'm going to take a seat and we can all get settled, and we'll do a little activity to get us all on the same page for thinking about this issue and to provide us a little bit of context. So again, thanks so much for being here this evening. So if you will take a moment and just close your eyes, I'd like you to imagine yourselves going about your day-to-day routine. Maybe you are waking up and getting yourself ready for the day. Imagine that you are off to take a shower, maybe you're putting on lotion, maybe you're getting dressed and you feel alone. Or perhaps you have gone in for your annual mammogram and you get a call that says, we need you to come back. We see something that's not quite right. Imagine that you have gone to the doctor, they've asked you to complete a biopsy, and now you're waiting for several days to get a phone call to let you know what the situation is. Finally, that phone rings and you get the call that says, we're sorry, what we found is breast cancer. Okay, everybody, let's open our eyes. So what goes through your mind when you imagine yourself receiving that call? What concerns come to mind for you? I'm going to list off a few concerns, and if you feel comfortable participating in this, I'd like you to raise your hand if that concern came to mind for you. How many of you felt immediate concern about being a burden to your family, your loved ones, and your friends? How many of you felt concern about where you would go to access the best care? Okay. How many of you felt concern about the emotional and physical toll that undergoing treatment might take on your body? Yeah. How many of you felt concerns about losing time to be with family and friends, missing out on those special moments? How many of you were worried about dying? Yeah. So these are real concerns that every person who is diagnosed with breast cancer has. And these are things that many of us don't necessarily have a clear way to address when we are making decisions about our medical treatment. That many times is beyond the scope of what happens when you're making decisions about, do I have surgery? Do I undergo chemotherapy? Do I undergo radiation? There's just now been a recent shift in thinking about a focus on psychosocial health. And that really has come from sort of a fundamental shift in how we are dealing with breast cancer. So we've made some significant advances in treatment. We've made some progress in earlier detection. And what that means is people are living much longer after a breast cancer diagnosis. So where all of our focus initially was on how do we get people into treatment so that they can live, now it's less about mortality and it's more about quality of life with the number of survivors that we have. So as of now, we have about 3 million breast cancer survivors, and that number is growing every single year. So we see some real inequities in the quality of life for women depending on where they live, how much money they make, and that is just a fundamental injustice. So psychosocial health focuses on the emotional, social, and mental well-being of an individual. So what I'd like us to do to sort of guide our conversation today is to think about all of those concerns that came to mind for you, and let's talk as a group about the things that we might need to help us deal with those things. So some of you mentioned worrying about where you would go for the best care. And I know it's loud in here, but if you have an idea about what you might do to figure out where to go for the best care, yell it out. Let's talk about it. I'm sorry? The internet. Going to the internet for information. You would probably look for medical reviews of practicing physicians, right? Who's got the best survival rates? Who's got the best patient outcomes for surgery, things of that nature. That is called informational support, right? Not only do we want information about the best places for care, we want information about our particular diagnosis, we want information about treatment options, and maybe we need tips and tricks for how to make our time with active treatment better and to make that adjustment back to our sort of day-to-day routines after we're done with treatment. Informational support is incredibly important to feel like you have control over the decisions that you're making about your health. But can you imagine living in a rural area with very limited internet infrastructure and you only have access to your medical team to answer your questions? What do you do when you don't have a reliable way to access the wealth of information that's available on the internet? That is a real problem for women who live in rural areas, and it's one that we need to work to address. Some of you talked about worrying about being a burden to your family and friends, to your loved ones. How might we go about dealing with that? What kind of help would you need? Any thoughts on that one? What about missing out on things? How many of you would actually have to, did I lose the mic? I'm so sorry about that. Is that better? Okay, sorry about that, guys. I think this is not the most conducive for people who wear glasses. Okay, so back to our concerns. We talked a little bit about being concerned about missing out on experiences with our family and friends, missing work to undergo treatment. What do you guys think about how you would deal with that? Who would you lean on to help you get to treatment or to keep you connected to those around you? Your family, if you had any. That's right. Yeah. Many people rely on family and friends and loved ones. For example, many of the women that I've talked to in my research talk about having that one person that goes with them to treatment, that is sort of there for them after to help, maintain things that have to happen day to day in the home, like prepping meals or doing laundry, doing the grocery shopping. How many of you would have someone that you could call on any time of day if you needed them to help you do something like that? Some of us, but not all of us, right? Some of us have family that live quite a distance away from us, and we may not be able to rely on them to be right there if we needed them. What happens if you have to travel an hour and a half, 2 hours to get to care? Would you be able to do that reliably? Would you need to miss work to do that? If you were undergoing treatment and weren't strong enough to drive yourself back, would you have someone who could take off work and go with you and drive you back? If that person misses work, do they still get paid? Does that become a financial concern for you and your family? These are all issues that women who live in rural areas face. Many women in urban areas face them as well, but given our lack of access to care, some of those constraints become real problems. Women are driving well over 2 hours to get to what may be required for their particular type of breast cancer, and that requires sacrifices on the part of their family and friends in order to make that happen. If there's a financial issue, where do you turn for assistance? Any ideas on what you would do if you had a financial struggle? Rocks?
Ask your parents, ask family.
Ask parents, ask family for help. Medicaid? Yeah, if you qualify. Yeah. What if your family's kind of strapped also? Cancer Society? Yeah. They might be able to help facilitate some services. Yeah. It's a real question that women have to face every day. What do I do in this situation? How do I pay the electric bill? How do I purchase gas to drive the 2 hours that I need to go to see my healthcare provider? How do I pay for this hotel room that we're going to have to stay in because I have to get radiation every single day for 6 weeks, right? Those are things that many of us take for granted, and we don't have to consider them until we're faced with a huge health crisis like a breast cancer diagnosis. Some of you also talked about challenges around what to do if you are undergoing treatment and you have real issues with side effects, the physical and emotional toll that might take on your body. What are some of the emotional challenges that you think you might deal with undergoing treatment? Being disfigured, yeah. Many women have to undergo lumpectomies, mastectomies. They lose their breasts, which, if we're being frank, is a real indication for your womanhood for a lot of women. They lose a sense of self when they lose those body parts, and that can be a real challenge. What other emotional challenges? Yeah. Fatigue, yeah. Yeah, so you're undergoing chemotherapy, radiation, recovering from surgery. That takes a huge toll on your body, and you're really limited in what you're able to do. You're absolutely right. And you need help as a result of those things. What other emotional challenges or mental challenges? Yes, sir.
Somebody who's pregnant
Oh,
who waits to deliver before they start their therapy.
oh yeah. That takes a real toll. It's not only are you worried about yourself, you're worried about the life of your unborn child. That has huge mental and emotional ramifications, not only for the individual, but for the family around them, right? There may be some disagreement about whether or not that was the appropriate choice to make, and there may be some real concerns about the mortality of that individual. So how many of you, recognizing that there are some real mental and emotional challenges with the breast cancer diagnosis, would know where to find a counselor or a psychiatrist to receive that sort of care? Would you be able to find one in your town? Do you know of a person that's right here for you to access? Yeah, it's tough. What if your insurance doesn't cover that? Speaking of insurance, what if you don't have it? Or what if it doesn't cover the experimental treatments that you might need as a result of your diagnosis? Right? These are all huge issues. Yes, ma'am.
How often do people seek counseling and support from support groups rather than professionals?
So that is a good question. Yeah, Rox asked how often people seek help from support groups and other sources of support rather than from professionals. And I think that's a good question. I think it's also a matter of access. How many of you know of a support group here? Anybody? Raise your hand if you know a support group. Okay, one that meets regularly? One that meets face-to-face and not online? Right. So you're not really sure where you might go, right? So your doctor is likely going to suggest that you find a professional. Some may mention a support group, but we find from the literature, from the research that's been done, that that is much less frequent than being recommended to see a professional. How many of you know someone close to you that has had a breast cancer diagnosis? Right, it touches so many of us. How many of you would feel comfortable if you had a diagnosis going to that individual and asking for help? Many women do that, right? They find peer support from someone who has a shared lived experience. And the research tells us that in many cases that has huge impact on positive health outcomes for women who are facing a breast cancer diagnosis. And it's one of the reasons why it's so important for us to identify resources like support groups or online platforms with fellow survivors that women can access. That is a huge problem in rural areas. Many of us are isolated. We don't know who else has had a breast cancer diagnosis, and we don't know how to find them if they do. So as we saw with the raise of hands here, we don't know, right? There are a couple that I can think of off the top of my head, but I don't know that that's common general knowledge. How many of you know how you would counsel your family and friends on their emotional struggles and the emotional sacrifices that they might need to make if you were diagnosed with breast cancer? Would you feel even remotely prepared to deal with that? Can you imagine if you had young children and you had to explain to them what your diagnosis was and what the possible outcomes of that might be? So we find that there are a relatively growing number of women who are diagnosed with breast cancer under 40, and many of them have children. But because the majority of women are diagnosed post 50, we don't have a lot of resources and materials available to help guide women who are young with young families who have been diagnosed with breast cancer. So all of these things are challenges, and when we have rural communities that are resource limited, that are economically challenged, that have healthcare access issues, all of these sorts of concerns become huge, huge problems. We talked a bit about informational support. Tangible support or instrumental support are those things that we talked about as helpful when people are able to come over and offer us some assistance with maybe cleaning the house or doing grocery shopping or preparing meals. I'm sorry, my microphone keeps moving. What other sorts of instrumental supports do you think would be useful for a breast cancer survivor? You mentioned being fatigued. You mentioned feeling disfigured. You mentioned some of the emotional challenges that might be associated with having family and friends. What help would you need?
Just simple errands.
Yeah.
Picking up food. You can't physically lift heavy things, so you can't lift groceries.
Yeah, exactly.
Like that.
Not being able to lift things like groceries. We live in a very hilly area. Many of our laundry facilities are in the basement. Can you imagine trying to carry your laundry from upstairs to downstairs and bending over to put things in the washer, bending over to pull things out of the dryer? Basic things like that are real needs that women have. And who would you call to help with that? Imagine if you lived alone. Right? Emotional support is a huge thing. We talk a lot about the anxiety, the fear that comes along with a breast cancer diagnosis. Many of you mentioned that you would turn to a family member or someone else that you knew that had had a diagnosis. What if you don't know anyone? Would you feel comfortable talking to your general family and friends that maybe don't really understand what breast cancer is and what it involves? How many of you would share your emotional concerns with family and friends? How many of you would worry about whether or not you were being a burden to your family and friends? Yeah, that happens a lot. We find that many women view themselves as the matriarchs of their family, and it's their responsibility to take care of everyone else. It's not everyone else's responsibility to take care of them. So rather than sharing their concerns and their feelings with their family and friends, they push it down, hold it in. I can figure this out on my own. And we know from previous studies that that sort of stress results in negative physical consequences as well as negative emotional consequences and leads to overall poorer health outcomes following your breast cancer diagnosis if that happens. So many times that peer support becomes really important because women won't utilize their family and friends. They would much rather speak to someone with a shared experience. And if there aren't any places to go for that support, then what do you do, right? Many women would rather go without support than to leverage family and friends instead. Yes, ma'am.
Do you find in rural areas that people tend to reach out and get support from the religious organizations?
I do, and that was one of the things I was going to bring up. Yes, do women reach out to their religious organizations for support? And yes, I think they do. I think many times people view their spirituality and their faith as a way to cope with the challenges that they're facing. I think too that it's a close-knit community, the church family. And so many times there are other women or men for that matter, we shouldn't discriminate, right? 1 in about 800 or so men will be diagnosed with breast cancer every year. So this is an issue that men will face also. But I think they do look for that peer support in their church families as well. But I think that prayer and that faith is a huge driving force as a coping mechanism for that emotional piece as well.
And then a follow-up, are pastors and what's the clergy, do they know typically the resources that are available in the communities?
I would say that varies from church to church. Oh, sorry, I keep forgetting to do that. Do pastors and members of the clergy know the resources that are available? And I think that probably varies from church to church. I think, too, it's also a matter of resources that exist. So there may be broad, general-based services that you might be able to recommend for someone for more universal issues that aren't cancer specific, but in terms of cancer specific supports, that may be more of a challenge. Yeah. So for example, some of those services might be a place to go for financial support if you need help paying a bill or if you need help with gas costs or with groceries or things of that nature, or you might be able to identify a service that would be able to come to your home to do some task that you might need. But those are things that are more generally available to everyone, but there may not be as much knowledge about where you might go if you needed a prosthesis, or where you might go if you needed a special bra to hold that prosthesis following your mastectomy, or where you might go to get a quality wig for a discounted price because you are a survivor. So those sorts of things I think are less well known in the community, not just by the clergy, but just by anyone that you might go to find advice about resources at this point. Yes, ma'am. Yeah. So the question was, do we find that there are cultural factors that play into whether or not people will seek care? Is that a good summary of your question? Maybe, yeah. Good summary? Okay. And I think that that is true to a certain extent. I think that we have found some shared cultural norms that sort of suggest a reluctance to engage in the healthcare system. And I think that's for a variety of reasons. Some of that is mistrust of the healthcare system. That is particularly true for minority populations, given some historical contexts of some inappropriate research experiences that have taken place, like the Tuskegee syphilis experiments and things of that nature. I think there is also some question about the term called fatalism, this idea that this is inevitable, it's going to happen to me, and whatever happens will happen. We see that a lot with certain rural areas where religion plays a very strict role in sort of the values that people have. I think that there's sort of a mentality that, God will see me through, whatever that means. And certainly these are not generalizations that apply to everyone. These are just some examples of findings that have happened in the research over time. I think that we've done a lot of good work with community outreach and education efforts to help women and families and communities understand the importance of breast health and the importance of screening and early detection. So I think we're seeing less of that become a problem. I think there's a willingness to access care. It's a question of, do I have the care available to access, right? So that's what we really see as the issue in rural areas. So many times women will actually have an abnormal result or get that lump checked out by a primary care physician, but then there's not a specialist available to then decide what needs to happen if there is in fact a diagnosis. So then they have to travel elsewhere for that specialty care. Those are great questions. Awesome. And you guys should all feel free to jump in and ask questions if you have them as we go along. So we've touched on informational support, we've touched on instrumental support, emotional support we sort of got into a little bit. I think that's the one that everybody thinks of when we talk about social support, right? Having somebody to talk to, a shoulder to cry on, somebody to lean on, and we talked about some of the challenges that we see with women in that regard. The final bit of social support that we look for is called appraisal support. And it's this idea that you have a connection to someone with a shared lived experience. And we talked a little bit about that with the peer support idea, getting information, getting tips, getting emotional support from someone who also has had a breast cancer diagnosis. That is a huge deal. I think that sense of not being alone in your journey can have a real impact on individuals, provide some hope. How comforted would you all feel if you had a breast cancer diagnosis and you knew that you had a place to go where you could talk to other women who also had that diagnosis? Yeah, but put your minds at ease, right? Maybe lessen that fear a little bit, maybe get rid of a little bit of that anxiety that you might feel about what happens next. Yeah. So all of these types of support go a long way to promoting psychosocial health. And we see some real inequities, not only in access to these supports in rural areas, but we see real inequities in the outcomes associated with breast cancer in that regard. So women who live in rural areas are much more likely to experience symptoms of anxiety and depression. They're much more likely to have difficulties adjusting to life as a cancer survivor. They're much more likely to have trouble adhering to their recommended treatments because of the mental and emotional toll that's taken on women undergoing that. And then because of that, they're much more likely to experience poorer health outcomes as a result, both in terms of quality of life, and mortality. So the research tells us this is a huge issue. It's really, really important for everyone who's facing a breast cancer diagnosis to have this type of support. Yet, given our conversation that we've had thus far, it's very apparent that not everyone has equal access to that support. So that sort of leads me into the research that I've been doing thus far in my time here at Ohio University. So currently, I am running a study where we are looking at the breast cancer experiences of women who live in rural areas and women who live in urban areas. So we've recruited women who are in and around the Columbus area, and then women who are in southeast Ohio, the Appalachian counties of Ohio. And we are asking them, what have been your needs since being diagnosed with breast cancer? And what have you been able to access to help you meet those needs? And many of the things that we've talked about today are the things that have come up in those studies. You had a question?
Yeah, so with your population in Columbus, is it the same socioeconomic that's in rural?
So there's a good mix. So even in the rural, is it a similar demographic makeup for the women who are in urban areas compared to the women who are in rural areas? And there's a good mix on both sides, honestly. We have women who are fairly affluent, both in the urban areas and in rural areas. And then we also have women who are on the lower end of the socioeconomic scale in the study as well. And so what we've tried to do in our recruitment is to be very purposeful in who we've talked to. We wanted to get as much diversity in those conversations as possible so that we could see what that experience looks like for as many different women as possible. That way we have a clearer idea of what the needs actually are. I think we make a lot of assumptions about what we think other people need without really knowing what they are. And then looking to see if the access to the resources that we know are available in the urban centers are making a difference in their outcomes compared to the outcomes for women in rural areas where we know some of those things are missing. Yes, ma'am. How do we find our research subjects? So I am partnered with an organization in Columbus called Cancer Support Community of Central Ohio. They are an agency in Columbus that focuses exclusively on the psychosocial health of cancer patients, not just breast cancer, all cancer types. But we have worked with them to reach out to the women with breast cancer who have utilized their services or have been recommended by someone who has utilized their services. In the rural areas, it's actually been entirely word of mouth. So we have had information about the study posted to social media, and we've sort of used the snowball sampling method where once we get one person, we're like, hey, do you know anybody? Can you recommend somebody that we can talk to? And that's worked wonderfully in the rural community as well. So right now we've gotten about 53 participants that we've done so far, and we've tried to make it an even split, and we're targeting 60 women total. So we'll look for 30 and 30. So we still need 2 more rural participants, and we've got 1 more urban participant to go, and then we will be done. We've got a couple lined up that we'll collect data from over the next couple of weeks.
So are you doing pencil and paper surveys, or are you actually interviewing?
We are actually interviewing every survivor that we meet with. So we sit down with what we call a semi-structured interview guide, which has a set of questions that generally guide the conversation, but it still allows room for anything that emerges as important to the participant to talk about. So we sort of touch on what women have found as challenging at diagnosis, at treatment, and following that. And then we talk about resources at each of those stages. But then we also ask questions like, if you could talk to another survivor, what would you suggest for them? What would you say to them? Or what do you feel like was missing? What did you need that you didn't have? And those sorts of questions really elicit things that maybe we hadn't thought of ahead of time. And we've gotten some really good responses from women that we've interviewed so far. So we're hoping that we can take this data that we're collecting and think about ways that we can create programs or other interventions that we can implement in rural areas to help connect women to support resources that would improve their psychosocial health overall, because we know that that leads to improved health outcomes. Yes, ma'am. Okay, so the question is, we've talked about a number of different types of support. What type of support do I think is most important for a woman who is undergoing undergoing breast cancer treatment or who is diagnosed with breast cancer? I think that is a really good question, and I think it varies from individual to individual. So we have to take into consideration personal traits and characteristics. There's a certain emphasis on resiliency and sort of an individual's ability to cope emotionally and to utilize those sorts of strategies. I think that the sort of dynamics of the social network around each individual also is really important. There will be differences from every woman with how connected she is to other people, and if those relationships are positive or negative, if people are willing to, take part in the journey with that person. All of those things sort of contribute to that. We're all different in how much information we feel we need. Some women are very much like, just tell me what to do. Like, I don't need all the details, just tell me what's gonna save my life, and that's what I'm gonna do. Some women are like, I want all the options, give me all the details, and I'm gonna pour over this, and I'm gonna decide what I think is best for me. And so given all of that variety, I think it really does depend individual to individual what type of support is most important for them. Great question. Yeah. Yes?
Is there a correlation between frequency and location?
So incidence is a great question. So the question is there a correlation between frequency and geographic location? So not really. We see a fairly consistent incidence rate of women who are diagnosed with breast cancer, regardless of whether they live in rural areas or urban areas. The difference is mortality rates. So if a woman lives in a rural area, she is more likely to die from breast cancer than if she lived in an urban area. And even though we've seen improvements in those mortality rates over the last couple of decades, the women in rural areas, those gains, those improvements in mortality rates trail behind the national improvements. And that's really pronounced here in Appalachia, for example. So national improvements have been about 20% or so. We've seen a 20% improvement in the number of women who live following a breast cancer diagnosis. In Appalachia, we've only seen about a 16% improvement. It's a pretty big difference, right? And a lot of that is a function of those access to care issues that we talked about, the lack of resources, some of the socioeconomic challenges. We've had interviews with women where they say, I missed this radiation appointment because I needed to buy groceries for my family. I had to go to work. So they're going to prioritize those that they have to care for over themselves 9 times out of 10. And that is a common occurrence that we see. And all of those decisions have implications on their long-term survival. So we see some of those differences, and it's part of the reason that this sort of work is so important in helping make sure that those basic needs are met, so that the only sort of impact on what happens is the treatment that you undergo, right? If everything else is equitable, then everyone's sort of starting from the same place and can reach their full health potential regardless of what diagnosis they have. It's a great question. Okay. Yes, sir.
Do you use any objective measures to differentiate between what's going on in a rural area and what's going on in an urban area? I'm thinking in particular of T-cell activity.
Okay, so what we do, any objective measures, and I think you used as an example T cell activity, and that would be more a biomedical or physiological indicator of a health outcome. So my field is public health, so we're a little less clinically focused, and we're a bit more sort of individual behavior and then community based in our research. But we do use scientific objective measures in our research. So we've talked about these quality of life issues, we've talked about some distress, anxiety, depression. They're all reliable and validated measurement scales that we can use in survey work or in interview work to assess those health issues so that they're objectively collected across participants and standardized in the way that we do that across participants. So it does allow us to get a true comparison across those different people that we talk to. Yes.
So Shannon, I'm curious. We're in a different generation now where we now have genetic testing and BRCA. And so I'm curious, what happens to the woman who knows that she's BRCA positive and that there is an X% chance that she will progress towards breast cancer? Do these people have counseling, or what are the social issues that they have to deal with?
Okay.
Even before diagnosis.
Right. So there's a question about the occurrence or sort of the emergence of genetic testing and genetic counseling, and what sort of support and needs are in place for women even before they get a breast cancer diagnosis, particularly if they are positive for a genetic mutation that indicates that they are more likely to have a diagnosis. So genetic testing is essentially a process that is used to look at your DNA, your genetic makeup, to determine if you have some change in your genes that makes you predisposed or more likely to have a breast cancer diagnosis. There are a number of different genes that we look at. We learn more and more about different genes that may be related every day. I think the ones that people are probably most familiar with are BRCA1 and BRCA2. And if a woman undergoes genetic testing and finds that she is positive for a genetic mutation that predisposes her to cancer, she has an option to then make prophylactic decisions, right? Whether or not she decides to undergo certain therapies to reduce her likelihood of having a breast cancer diagnosis in the future. The degree to which that treatment, that therapy that they choose to undergo depends on which genetic mutation they have and how much of an increase in probability is there based on that mutation. I think we're all probably familiar with Angelina Jolie, who talked about her decision to do a double mastectomy following a positive genetic test. That is an extreme example. Not every woman will need to have a bilateral mastectomy to remove both breasts following a positive genetic test. But some women will do that. Some women will choose to go on a hormone therapy that will essentially send her into menopause, right? Many of the breast cancers that we see are estrogen positive, which means that the estrogen that your body produces fuels the cancer. So if you shut down your estrogen production, then it limits the ability of the cancer to progress. So women will go on hormone therapy to address that issue. So all of those are options. There is not necessarily a specific counseling that women will undergo for that. They do that in consultation with their oncologist. They do that in consultation with the genetic specialist. But there's not necessarily a counseling that's focused on their mental and emotional health around that decision. Yes.
It strikes me that you're in the area of public health, but that is very closely gynecology. And do you participate in, are there organizations out of your field that try to exert political influence to get more support for?
So the question is, public health is very tied to politics? And are there organizations that I am involved in or that the field is connected to that lobby or are involved in politics to secure more resources? And the answer to that is yes and yes. So we have a large national organization, the American Public Health Association, that represents our field. And they lobby and advocate for additional funding to support research and public health programs that we would implement in a situation like this. So we would we see a lot that there's tons of money behind pharmaceutical development, right, for medication development. We see lots of money behind clinical therapies and things of that nature. There's very little money that goes into public health work. It's really difficult to argue that, you know, we prevented millions of people from getting sick by doing this work, right? You can't see it, you can't quantify it, so it's really difficult to get that sort of support. So we do have some organizations that work really hard to try to expand the awareness about the type of work that we do so that we can secure additional funds to do this sort of research and to put money behind programs and resources for individuals to promote their health. See, any other questions, or are we good on time? Yes, ma'am.
In this region, are there funds available, like from major donors or philanthropists that help seed money for people in need?
So the question is, are there philanthropists or other donors that are willing to put money behind these sorts of efforts to help people in the region? I'm sure there are. I am unaware of any currently. I will say that most of the work that happens is supported by federal and nonprofit grants. So for example, I recently wrote a grant to the American Cancer Society with preliminary data from the project that I talked about a little bit ago to hopefully use that information to create programs for the area. So I hope that that gets funded, but if it doesn't, then there's sort of a delay in the ability to do anything with the findings that we have. But of course, if anybody knows a philanthropist or a wealthy donor who's interested in putting some money forth, I think this is a good cause and we could do a lot of good things with their money. Awesome. Well, I think I am running short on time, so I'll just close it out by saying that I hope this has sort of helped you envision the type of support that breast cancer survivors might need, so that if you know someone, you can be of support to them. And then I will just reiterate that we still do have a couple of slots available for interviews. If you know a breast cancer survivor who you think might be willing to share their story, I have cards in the back on the table there. If you're interested, you can take my information and send me an email or give me a call if you are interested in participating yourself or if you know someone who may be. But thank you so much for being here today. It's been a fantastic conversation, and I hope that we get the opportunity to do some more great work in the area.
Thanks, Shannon.